skin doesn't have the ability to retain moisture the same way that it does when we're younger. So in your daily moisturizer or in your foundation, you should look for one that contains sunscreen, or apply sunscreen underneath your foundation every day. Antioxidants, you may have seen a lot of skin lotions on the market. They talk about containing antioxidants. Are these things really important? Well, a lot of the studies do show that antioxidants within the skin lotions do get absorbed into the skin and can alter gene expression, making the skin act and look younger. So I'm going to talk a little bit about some vitamin A derivatives in a minute, but also vitamin C and vitamin E within skin products has been shown to rejuvenate the skin. And also nutritional supplements. So if antioxidants are good to put on the skin, is it also good to take antioxidants orally to rid yourself of free radicals and to rejuvenate the cells from the inside out, not only the skin cells, but all the cells? So the answer is probably yes. And I have Daniel O'Connor here, if you want to raise your hand. He is representative from Nutrimetrics. We carry this in our office. I'm not here to promote any particular products, but if you have any questions about nutritional supplements, he can certainly field those questions. So topical tretinoin, this is the derivative of vitamin A. Many of you have heard of it, retinoic acid. Trade names are Retin-A, Retin-A. And lastly, it promotes collagen synthesis and decreases collagen degradation, thereby thickening the deeper layers, the dermis of the skin, and improves the coarse wrinkles from the bottom up. So this is prescribed in a cream or a gel form, 0.05% or 0.1%, and you want to use it at night. You use it at night because this product can increase your sun sensitivity. So it'll make you slightly more likely to get a sunburn. So you want to apply it at night. And some people do complain because of the second action there that's listed, that it does dry the skin and cause you to have flakiness of the skin. So some people can't tolerate it every night. So what I generally recommend is in the palm of your hand, put half and half moisturizer and Retin-A. Mix it until you can actually tolerate it full strength at the 0.5%, and then go up to the 0.1%. So then moving a little bit deeper. So those were just topical things that you can do. Skin resurfacing is a minimally invasive procedure, and I'll go into some more details about it, what you can do to kind of peel away the outer layers and rejuvenate the skin. So intense pulse light has been around for many years, and there are many iterations of it, many different types, different names, but basically it's a treatment that uses broadband light to penetrate at different depths of the skin to treat a variety of conditions. Forever Young BBL is the IPL system technology by Cyton. And we have Justin Levy here, who's in the back, raising his hand over there. And he can talk to you more about if you have any questions after about how we use lasers in the practice. But I'll go over the details here. So BBL can be used to treat a variety of conditions. It can reduce skin pigment, reduce age spots, increase the firmness of your skin, reduce skin laxity, diminish the appearance of fine lines, and also can be used to treat unwanted hair and control acne. And the BBL treatment generally treats wavelengths 500 to 1400 on the bottom of that scale over there. So broadband light can also be used as a maintenance treatment, and I'll show you some examples in a few minutes, to be able to rejuvenate the skin anywhere in the body over a long period of time. And there was a study performed at Stanford that showed that broadband light treatments altered gene expression so that the cells resemble younger skin, and thereby rejuvenating the appearance of the skin by increasing collagen deposition and decreasing the loss of elasticity in the skin. And this was presented in the Journal of Investigative Dermatology. So a couple of results. So starting at the top, these are patients who have had recent treatments. Each have had 2 treatments. The one on the top left is a young girl who's had 2 BBL treatments. And after 2 weeks, you can see that a lot of her skin discoloration is gone, a lot of the freckling is gone, and she has a better light translucency to the skin. And her skin overall looks younger with fewer fine lines. The top right is a woman who had her décolletage treated because as we wear low-cut shirts, we get a lot of sun exposure, sunspots, and as we get older, you get more of a picture in the upper left corner there. So after 2 treatments, she looks much younger and her skin quality looks better as well. The bottom 2 talk about the maintenance program of using BBL over a long period of time. So what's interesting on the bottom left is that this woman is 11 years older in the photo on the right side. So she's had 32 treatments of BBL over this time, and to me, it looks as if she's younger on the photo on the right than she is on the left, despite the fact that she's 11 years older. The skin quality looks better, and she has fewer sunspots and freckling. Same thing with the lady on the lower right. She's 9 years older. She's had so laser treatment. What are the treatment goals for laser? To remove the visible signs of skin damage, to rejuvenate the dermal collagen matrix and improve wrinkles, scar scars, tone and texture, and you want to provide a safe and effective treatment that has minimal downtime. So what are the indications for laser therapy, some of which I've touched on here? So skin rejuvenation, presence of mild to deep wrinkles, fine lines, perioral and periorbital rhytids, treating acne scars, surgical scars and post-traumatic scars, and it can also be used to treat actinic keratoses, which are precancerous lesions, and pigmented lesions such as melasma and freckles. So this is a lady who's had a nano laser peel, and like I said, it's 4 to 10 microns, very, very superficial. She had no anesthesia for this procedure, and she can be back to work in 1 day. You can see the picture on the right. Her skin looks a little bit brighter. The outer layer is gone. You see somewhat of a change. It's a minimal change. It's a very light peel. So there's essentially no downtime with this. This woman here, and you can see a progression of her photos from pre-to damage. With this, you have about a downtime of 7 to 10 days. You can go back to work at that time, and you do need an anesthesia block for this procedure. So this woman here is 63. She had a treatment, and this is her result 3 years later. So you can see she has good change in her wrinkles. The fine lines are definitely decreased, and her complexion overall looks better. So moving on to a little bit deeper. So if surface resurfacing isn't going to work, what else can we do to fill in these wrinkles and to change the appearance without doing surgery? This is still minimally invasive. Okay, so neuromodulators. Everyone here has heard of Botox. Botox is just one brand. Basically, botulinum toxins have been used for many different indications, both cosmetic and medical, to treat and weaken muscles to decrease the creases that are around them and superficial to them. So the cosmetic indications are to treat wrinkles and overactive muscles, and the effects last for about 3 to 6 months, depending on where it's used. So the most common thing that people complain of are the 11 lines at the glabella or the forehead lines, and they want those treated. If you weaken the muscles underneath, whenever you crunch your eyebrows together or raise your eyebrows up, you no longer have to strengthen the muscle to create that wrinkle. So it can also be used for crow's feet, and on the right-hand side are some other indications it can be used to get rid of some of the wrinkles in the neck and also dimples in the cheek and so forth. It's the most common non-invasive cosmetic procedure performed in the U.S., and there were over 6 million procedures performed last year for Botox. There are also medical indications, and Botox has been around for quite some time. It can be used to treat migraine headaches. You inject into the temples, scalp, forehead, neck muscles, and shoulders. It can also be used to treat excessive sweating in the armpits, called hyperhidrosis. Sometimes this condition is actually debilitating, and people have to change their clothes multiple times per day, and this can help because it paralyzes the small sweat glands. And this Botox can also be used to treat neck spasms and urinary incontinence. So in a couple of other slides, I'm going to talk about cosmetic indications versus medical. When I say medical, that means it may be covered under your insurance. There's a lot on this slide, but this is important as far as fillers. I get a lot of questions about fillers. So Botox is different. It's not filling anything. It's just weakening the muscle so you don't cause that crease to be there. Fillers are filling the wrinkles that are there when you're just statically looking at somebody. So the smile lines around the mouth, the marionette lines on the sides of the chin, and some creases in the forehead that may just be present even at rest. So this lady clearly has some indications for some filler. So I broke them down into 4 categories. The first one is called hyaluronic acids. It's a naturally occurring substance in the body, and it can be used as a dermal filler. So it's filling the deep layer of the skin to plump up the deep layer to get rid of the wrinkle above it. The ones that you've probably heard of, the trade names are Restylane, Perlane, Juvederm, Prevel, and there are many others on the market. This lasts about 6 to 12 months in the smile lines and about 6 months in the lips. People use it to plump up their lips as well. The second one is called calcium hydroxylapatite, also called Radius. So this one corrects moderate to severe facial wrinkles and folds and can last for up to 18 months. The third one is poly-L-lactic acid, also known as Sculptra. This one, as compared to the first 2, is more of a volumizing agent, where you get a series of injections, and it actually helps to promote the production of collagen in the deeper layers of the skin to cause a longer lasting effect. And these effects can last for up to 2 years. The first 2, the hyaluronic acids and the calcium hydroxylapatite, those you see an effect right away, and you see the maximum effect of 2 to 3 days because these products actually bring water in from the surrounding tissue. So you plump up over a couple of days. The fourth one is really the gold standard for filling creases. It's autologous fat grafting. Because if we think about our faces over time, so for first-time filler users, I usually use a hyaluronic acid filler because it's reversible. If the person doesn't like it, or they have a bad reaction, which I've never seen, but it can happen supposedly, is reversible. You inject White-Ace, it's gone. So for the nasolabial folds, I'll usually use Restylane or Perlane. For the lips, I use Juvederm, Restylane or Perlane, and under the eyes, I use Restylane. So then a patient comes back for subsequent fillers, and how do we choose what to do? Well, if the patient liked their treatment and they want to stay with it, then I'll just continue the same treatment. For the cheeks and the nasolabial folds, I might move on to something that lasts a little longer, like the Radius. And then also consider something like Sculptra if they want to commit to 3 or 4 injections and get a 2-year result for that. And then autologous fat grafting, like I said, is really the gold standard. It's really the best. If somebody wants to undergo that procedure, they can really have permanent facial filling. So now moving on to a little bit more invasive in the way of procedures. So facelift. A lot of people ask me about facelifts. So it's actually the 5th most common cosmetic surgery procedure performed last year in females. So as we age, the face descends and deflates. So the goal of the facelift is to restore a heart-shaped appearance to the face and remove excess skin that's wrinkled in the face and the neck. So a facelift was performed on this patient on the right-hand side. You can see on the top over here, let's see, is this the laser? Yeah. She has a squaring of the face. She also has jowls down here, and she has some creases in her neck. From the side, she has turkey goblet neck right there, and it looks as if her chin is no longer projecting, and she has a loss of her contour of the face here. She lost the jawline. So the goal of this is to restore all of those things. So you can combine a facelift with laser resurfacing, as we mentioned. You can do a periorally and periorbitally. You can also do liposuction of the neck if that's necessary. This patient had direct excision because I did a neck lift on her. Or you can do fat grafting to areas if she wanted fat grafting here or into the lips. Eyelid surgery, another very common procedure done either for medical or for cosmetic reasons. So the cosmetic indications would be for drooping excess skin of the upper eyelids, excess skin of the lower eyelids, the crepey skin that you can see here, or if a person has bags under the eyes, those can be treated as well. So laser can also be used if it's just loose skin in the lower eyelids, like this patient potentially could have had laser done there to tighten up some of that skin. So the fat underneath the eyelids can be removed or repositioned. There are medical indications, and the excess skin, if it's so heavy, it can actually be sitting on the lash line and obstruct the vision. So sometimes this is covered under insurance if your vision is needing rhinoplasty. And I generally recommend that they wait until they're 16 or 17 years old because you want to finish growth before you go ahead and do any kind of surgery. This patient here had a closed rhinoplasty. Her concern was the drooping of the tip and the very prominent dorsum, and her nose hung down like this, and she just didn't like the overall contour. She had a closed rhinoplasty, no outside incisions, and her dorsum straight. Her nose is much more appropriately sized for her face. Moving on to body surgery. So some of these are medical, some of them are cosmetic, and some of the pictures are a little bit graphic. So, breast surgery. So probably my most common breast surgery that I performed is either a breast reduction or a breast lift. And I do them anywhere from 17 or 18 years old up to 60 and 70 years old. Just depends on what's going on at the time. So symptomatic macromastia is when your breasts are so large, they're leaning forward, pulling you forward, and causing breast pain, upper back and neck pain, shoulder grooving from the bra, or arm pain. And breast reductions can be covered under insurance if you meet the proper criteria. This lady here, her breasts are down to her belly button. She has skin that has become hyperpigmented because of the chronic bra usage. You can't see her shoulders here, but she also has dark lines on her shoulders. So this is her about a few weeks after her surgery. She, obviously, you can see her abdomen here. So her breasts are much smaller, and she's much more comfortable. I ask every patient who has a breast reduction for medical indications, afterwards if they have any back or neck pain, and they think about it for a second, and they say, no, I haven't had any back or neck pain since I had surgery. So it must be, retrospectively, it seems successful. This actually is a 17-year-old girl that for some reason just has she hasn't had any kids, she just has droopy, large breasts, almost down to her belly button. She's a very skinny girl. You can see this is 7 months after her procedure, and she's loving her new shape. Okay, breast augmentation. This is the most common cosmetic surgery procedure performed in the U.S., obviously in women, and the rates are rising every year. So augmentation can be performed with either saline or silicone implants, and the incisions can be perioreolar, which is what this girl had, from the 3 o'clock to the 9 o'clock position. You can put them inframammary, which would be down here under the crease, or axillary up into the armpit. So just depending on the patient, where they want their incisions, what they need done is how I determine where their incision's going to be. This girl had silicone implants placed, and she's a few weeks after her surgery just here. And you can also combine this with a breast lift, depending on if they have any excess skin. Breast reconstruction. I include this slide here because breast cancer is the most common cancer in females, second only to skin cancer. And 12% of women, this is over the national statistic, 12% of women will develop breast cancer in their lifetime. So there are multiple types of reconstruction, and I'm just going to go over them briefly here. So autologous tissue reconstruction, what does that mean? It means using your own tissue to reconstruct the breast. So you can either use abdominal tissue, you can use the back tissue, you can use tissue from any other area of the body where you can reattach small blood vessels called free tissue transfer. Or you can have an implant-based reconstruction, which is either one stage, direct to implant, or two stage with a tissue expander. And determining what type of reconstruction is based on the patient, whether they need chemotherapy, whether they need radiation, and what they're looking for, what their goals are. So this patient here is a patient of mine who had a left-sided breast cancer, had a mastectomy, and had an implant-based reconstruction, two-stage, with tissue expander and subsequent implant, and she had a lift on the right side for symmetry, because she's going to undergo a nipple reconstruction, and it's going to be placed in this position here. So on to some body contouring. So probably the most common body contouring procedure that I perform is a tummy tuck, also known as an abdominoplasty. And this contours the anterior abdomen. It involves tightening up the muscles and excising the excess skin. And liposuction of the love handles can also be performed at the same time as this procedure. And generally, patients who need a tummy tuck do generally need liposuction to be performed, and it improves the overall contour. So candidates for this procedure are generally women who have had children, and you get weakening of the abdominal wall here. You can see her abdominal muscles are splayed apart. They also may have a hernia, excess skin down here, and they also may just have had excessive weight, and they lost weight, and they could have either lost the weight naturally or from surgical weight loss, gastric banding, and gastric bypass. So this is a patient here, and this is her 7-month result. She also had a hernia in the umbilicus, which was repaired at the time of the surgery. Liposuction can be performed alone in the proper candidate, and it can also be performed in conjunction with other procedures. When you harvest this fat, you can either get rid of it or you can transfer it to other areas. So some people want a Brazilian butt lift, they want buttocks augmentation. Some people want to put it into their face, so it just depends on what the patient wants. Most times we just discard it. So generally we inject 2 massive fluid. It has local anesthesia in it, and there's also epinephrine to control the bleeding and bruising afterwards. Patients go into a post-surgical garment, they wear that for several weeks afterwards, and they're good to go. So this lady had her love handles done, and you can see she has a much better shape here. This lady here had her tummy and back done, and this is her post-operative picture. There are different types of liposuction. It just depends on what the goals are of the patient and what area of the body we're doing liposuction on, determining what kind of procedure we do. Surgery after massive weight loss. So that's basically anyone who's lost more than 80 pounds and they have excess skin like this. So this particular patient had gastric bypass done. She has tiny incisions right over here. And she lost somewhere between 80 and 100 pounds. The only thing that's been done between here and here is the circumferential body lift. She did not lose any additional weight. So all of this skin was cut off circumferentially. So this is a good surgery for patients who have had gastric banding, gastric bypass, or gastric sleeve procedures. Generally, for a patient to be a good candidate for the surgery, their weight has to be stable for 12 to 18 months, and they have to be nutritionally sound. And sometimes these patients also have other procedures performed, arm lifts, thigh lifts, breast lifts, plus or minus implants, done at the same time or in a subsequent surgery. And I know this is mostly about female wellness and health, but I just thought I'd mention a couple of surgeries on men because we all have spouses and significant others and children who may be candidates, and they may ask us about this stuff. So facelifts in men. They are done. They account for only about 10% of the total number of facelifts performed in the U.S., 90% of them being performed on women. However, there has been a significant rise, 7% in the last year, of facelifts in men from previous years. It was the 5th most common cosmetic surgery procedure performed in men. And many studies have been done questioning why are men now getting facelifts where they didn't before. And they think that this has to do with the increasing age of retirement and these older men needing to compete with the younger men for jobs in the workplace. So men are coming into my practice asking for facelifts, eyelid rejuvenation, laser therapies, and maybe they're just more aware of their look and they want to have cosmetic surgery done. And I picked this particular patient because he has no hair to hide his scars. And you can see that even at 6 weeks, the scar is pretty well hidden. So that'll get lighter over time, but not much of a scar from the facelift. Generally, men also have complaints about their neck because they complain of this excess skin and fat down there. So usually you combine the facelift with a neck lift and they get a good contour change there. Rhinoplasty is the most common cosmetic surgery procedure performed in men, making up 30% of the total procedures performed last year. And a lot of them are done solely for cosmetic reasons to reduce the dorsal hump, where you can see on this patient over here, he had a dorsal hump that he didn't like. And there may be a functional portion to this procedure as well, straightening out a deviated septum or post-traumatic from a trauma with broken nose in the past. And lastly, gynecomastia. So in a similar way that we talked about breast reduction in females, sometimes men develop breast tissue and should or want to have it removed. And the general time in a male's life when they develop breast tissue is in adolescence. And it peaks during puberty and resolves spontaneously in 90% of boys within 3 years. However, 10% of them don't resolve, and then they end up looking like this. And this has psychological implications as well as just physical implications. You can get rashes underneath here, and you really can't exercise all that well if you have all this tissue, because a male's not going to wear a bra when they go exercise. So this is a 20-year-old boy who worked out and lost weight to the point you can see he has very well-developed chest muscles and arm muscles, but he still couldn't lose this excess breast tissue here. So he underwent surgery. He had very severe gynecomastia, so he needed an incision down here and free nipple grafting. But you can see the goal was attained here, where he has a good contour to his chest, which is what he was looking for. So gynecomastia can also occur in adults due to hormonal changes and increases in body fat as we get older. That can be treated also with surgical indications. For mild cases, they can just get a periureolar incision, so it would be just around here, like in the female in the earlier slide, or in severe cases, they need a larger incision like this to excise all of the excess skin. And sometimes this is covered under insurance. So that's what I thought I'd talk to you guys about tonight. I don't know if you have any questions, but many of my office staff are back there. They can field some questions too afterwards. And feel free to drop by our office.
Rise in deficiency of vitamin D. Is this because people are using sunscreen that's blocking out vitamin D? I mean, it's this, if I used less sunscreen and went out and took a walk for 15 minutes a day, got sun on my face and body, I wouldn't have this deficiency, but I'd have more freckles. So there's this trade-off. Are we seeing this increase in vitamin D deficiency because of the sunlight?
I think probably not, because as much as
Repeat the
everyone
question, please.
So the question was, are we seeing an increase in vitamin D deficiency because we're encouraging the use of sunscreen? And as much as I would like to say that if I tell everyone to wear sunscreen that they're really doing it, a lot of people aren't doing it. And the statistics, at least from last I read on vitamin D, is 80% of white Americans, or I think it was an American study, are deficient in vitamin D. And I would venture to guess that 80% of people are not religiously putting sunscreen on their entire body every single day. So I think it just may be true and unrelated that there's, yeah. I mean, I'd like to say that everyone's using sunscreen to the point where they're getting the sun exposure, but I don't think it's actually. So I think we all still need to take vitamin D supplementation. Like I said, we're 30 SPF or higher, and you want to make sure that it's UVA and UVB, and it's covering both.
But besides that,
I wouldn't say that any are better. The ones, you want something on the face that's not oil-based because it's going to give you acne and breakouts. On the body, you just want something that's going to be able to stay on. If you're going in the water, you want a water-resistant one. But I don't know that I can say that some are better
versus like
than others.
organic sunscreens versus, like Neutrogena or Body Face.
I generally recommend just, if it's commercially available and it's good. If you feel strongly about using organic products, I think that's good.
Okay. Just great.
So I just
Yes,
want,
Mrs. Sheridan.
yes, I just wanted you to touch on the fact that most breast reductions are
Is also covered, and rhinoplasty. Sometimes if the person has a deviated septum or has airway problems, part of that procedure is also covered.
More questions, okay?
Samara,